thank you, Damata, for the introduction. Like you said, my name is Enefola Odiba, and I'll be your trainer for today. Okay, so today we will move on to the topic that I've captioned demystifying project management. You know, most times when we talk about project management, a lot of people think, oh, it's for engineers. By the end of today, you will know that everyone needs project management skills or experience. And based on our own positions here, most of us here are senior executives. And I'm sure we all, even personal projects, we handle them. We give out projects. Then how do you ensure that you do this thing effectively and efficiently? And there are certain skills you learn from here today that will even help you in your own personal journey. And please pay serious attention, please. Then before I move on, it's to be good for me to know the delegates. Just 1 minute, please, because of our time. Your name, as brief as you can. The MDA, whether your ministry, department or agency, then your title, your current location, just brief, maybe 2 lines of roles and responsibility. Have you done any formal project management training? Or what's the level of your experience? Maybe from 1 to 10 for today, for now. Then what are your expectations? Why are you here? So I'll hand over the microphone. I'll start with ladies first.
Distinguished colleagues, good morning everyone. I'm sure we had a great night. My name is Honorable Mojisola Limakoli. I'm the Executive Director of Operations of the Nigerian Social Insurance Trust Fund.
Yeah, have you got any project management? You can follow that as much as possible, boss.
Okay, my roles, let me skip the title application. My role and responsibility as the Executive Director of Operations, maybe I should let you into my directorate, give you a snippet into it.
Okay.
Well, it's a directorate that it's actually the heartbeat of the Nigerian Social Insurance. What we do basically is to ensure that we work in line with the directives of the Act that has established the NSITF, and that is to pay to make sure that we get our contributions, our 1% emolument from our employers. I'm sure employers that are here don't like to hear that, but and then again, the most important thing is to ensure that the Nigerian workforce is catered to in the course of work, where there are fatalities or accident or in case of death, which we usually do not look forward to. But these things happen, and therefore employers are permitted to, claim claims from us. So we pay claims and compensation to the Nigerian employer that needs to be compensated, by virtue of paying the 1% emolument to us. So once they they're registered with the NSITF, it's our obligation to ensure that when there are fatalities, we respond as swiftly as possible. We have branches across the country. We have 64 branches under my directorate, and I have 3,900 workers under my directorate. I have 8 departments, and I have 8 general managers. I have 13 regions. One of my regional manager is Madam Bridget Ashan. Mrs. Bridget Ashan heads the FCT region of the Nigerian Social Insurance Trust Fund.
All right, thank you.
And
expectation?
Well, my expectation is to actually expand. We're currently looking at expanding, creating more branches across the country so that we can actually trickle down to the nooks and crannies of Nigeria, so that every Nigerian workforce can actually benefit from what we have, and also to see that Nigeria is, that the Nigerian workforce is safe, well catered to.
That's a big project coming up. All right, thank you, sir.
Yes. My name is Abdullah Sheikh Mohammed. I'm the proprietor of Standard College of Nursing Sciences, Mina. The school is located in Mina. Secondly, I would like to say this. Actually, I was an investigator with EFCC for 18 years. So in 2022, I resigned, and then I took over the management of the college.
Okay.
Yes. So I'm not a nurse,
but
actually I supervise entirely the activities of the college through expansion, introducing so many courses.
Okay.
From the period I took over, we have graduated 3 sets of students. The first set were able to got almost 98%. Out of 61 students that sat for the exam, 60 passed. Second stage, the second stage of students that graduated, all of them we got 100%. And this is due to our efforts.
Okay.
Yes.
All right, thank you.
Good morning, distinguished participants. My name is Joseph Namwakoto, Medical Director of Federal Medical Center, Makurdi. I'm a professor of orthopedic surgery. As a medical director of a federal tertiary hospital, my duty is to ensure quality healthcare delivery to the community or to the good people of Benue State and environs. And by doing this, I have to ensure that all my staffs, all the facilities, everything is functional, so that at the end of the day, we'll be able to deliver quality and effective treatment to our community. I don't think I've had any previous experience in project management, but my expectation is to do better and move Federal Medical Center Makurdi to a higher level. Thank you.
Thank you, sir. Thank you.
Good morning, distinguished participants, our resource person. My name is Honorable Yetunde Ujo. I'm the Managing Director, Chief Executive of Federal Housing Authority of Nigeria. And we are located in Abuja as the headquarters and all over the 36 states of the Federation. Workforce, direct workforce of about 1,500. Adult staff of close to about 10,000. Because that's housing construction for you. And our roles and responsibility as a CEO, everything starts on my table, ends on my table, because you get blamed for what even you don't know, so you have to be on top of it. And what's our responsibility? Our responsibility is to make sure we provide affordable housing for Nigerians, which it's not only our agencies alone, private developers, in terms of even other, some smaller agencies, FMDN does that, the monetary banks and everything. But I is to see for the overall building of houses in the country. Under us right now, we have close to about 320 houses, because in the past it was FHA that built Festac, build Guarimpa at 80%, Ilugbe at 80%, not to talk all over the country. Right now, we started the renewable agenda under our President Bola Ahmed Tinubu all over the country, and we've gotten lands all over the country. We're planning to do it in phases, like the Prof said yesterday, in sprints. Housing projects are not things you just wake up one day and you deliver. It takes a lot of time, and my responsibility as well along the line is to move around, even though I have other directors, other GMs who does that on my behalf. But as the head, I usually tell people, once you have lived abroad, or even when you wake up in the morning and you look at CNN, you must find out of BBC where the president or the prime minister of the country is. So the MD must always be on top of the game to make delivery. So by doing that, very shortly we are starting the project around the country. We've been doing some commissioning things, I mean? Well, I've been involved in a lot of project management training courses here and there, so I want to go at time. What's my expectation? Our expectation is to deliver houses for Nigerians at not just building the houses, but at an affordable rate. Even like I said, we are not being funded. It's self-generated IGR. But I say since private does that successfully, then why not government? So presently as well, I can probably say it's within a short space of 1 year, 3 months, we've been doing some commissionings in Oyo State, Ibadan, in Abuja, and our next movement will be Odubani. So at the end of the day, well, we'll try our own best. We leave the rest for God. Thank you.
Thank you. Thank you.
The esteemed lecturer, my distinguished participants, good morning. I am Dr. Salis Mahaswara, MNI, the Chief Medical Director of Federal University Teaching Hospital Duse, Jigawa State. As the Chief Medical Director of that institution, I am saddled with the responsibility of overseeing delivery of quality healthcare services to the people and training in terms of both undergraduate and postgraduate doctors and other allied health sciences. Again, we also oversee the conduct of research in health and other related matters with the aim of improving healthcare delivery and improving the health status of Nigerians. As Chief Medical Director and CEO, I oversee these three fundamental mandates of any federal teaching hospital in Nigeria. The institution is relatively new. I took over in December last year, and currently we'll start graduating medical doctors by May next year as a new institution. We have a medical college that has 5 sets of medical students. As part of my experience in terms of project management, prior to this my appointment, I was a permanent secretary in the Ministry of Health, Jigawa State, and I oversee many projects, both in terms of conception, implementation, and monitoring and evaluation. So I have some little experience in that. So what are my expectations in this executive course? I think what I need is to polish or to refine some of those rudimentary background knowledge in project management so that I can use that to further enhance project monitoring in the new institution that I'm governing now. So thank you very much.
Thank you. Thank you.
Okay, Mr. Trainer, our honorable trainer, our colleagues, good morning. Ladies and gentlemen, good morning. I am Muhammad Al-Hassan, the Honorable Commissioner, Ministry of Water Resources, Jigawa State. The basic function of or roles and responsibilities of the ministry is to provide access to safe drinking water and also sanitation within the state. The ministry comprises of 3 agencies apart from the ministry itself, that is the headquarters. It is water board that supplies water and to all major towns within the state. Then we have another agency that is called Small Towns Water Supply Agency. Basically, it is responsible for providing water and sanitation for all the local government headquarters. Then the third one is Rural Water Supply and Sanitation Agency, RUWASA, which is responsible for supplying water and also sanitation, as it is named, to rural areas. By definition, a rural area is an area that was designated to have from 1 person to 5,000 people. Then the small towns from 5,000 to 20,000. Then major towns and above.
Okay, good.
So So far, Jigawa State has achieved 92% supply access to supply to safe drinking water to its people. That is by UNICEF standard. So we are expecting, that's our expectation now, by doing all what we are doing, training here, their commitment there is to make sure that we achieve 100% by the grace of the Almighty at the end of this tenure. And we are doing that by making sure that we are concentrating on what we call the hard to reach areas. Because those areas are what make up the 8% that we are not able to achieve. So thank you very much.
All right, thank you.
Yeah, I'm Aminu Dogandaji, Director Special Duties, Federal Ministry of Industry, Trade and Investment, Abuja. I expect a deeper understanding of the concept of project management and how it applies to my day-to-day work. Thank you.
Thank you. Well done.
Good morning. My name is Husseini Mohamed Anani, Deputy Director in the Office of the Head of the Civil Service of the Federation, and Director of Administration at the Intercountry Center for Oral Health for Africa, JOS. I hold BSc in Political Science, Masters in Public Policy and Administration, and Doctor of Public Administration in view. So my role is Head of HR and Administration, which is a general philosophy to manage human. So I think it's a good one.
Thank you.
But the center is a oral hospital, a research center that is supposed to cover the whole of Africa in collaboration with WHO. So far this is where we are.
Okay, thank you.
Distinguished participants, our resource person, good morning. My name is Mohammed Nazir Abbas. I double as the Director Reform, Coordination, and then Director Overseeing Office of the Permanent Secretary. I assist the Permanent Secretary in coordinating the activities of the ministries and the parastatals under the ministry. And once he's not around, I take full charge of coordinating the management ministry and the rest in terms of the mandate of the ministry. And I assist the ministers. We have 2 ministers in achieving their mandate. In terms of formal project management training, when I was in Ministry of Finance, I was in the Economic and International Economic Relations Department. I was the head of AGRIC, in charge of World Bank project, IFAD, and Islamic Development Bank. So I think I had a number of training in terms of the project management and the rest. So my expectation may be to refresh my previous trainings, and then I look forward to have more understanding and new ways of managing projects. Thank you so much.
All right, thank you. Thank you, sir.
Yes, sir.
Thank you, facilitator and participants. I'm Saad Ahmed, the Medical Director, Federal Medical Center, Abuja. I'm a Professor of Pathology. My role and responsibilities is actually to oversee the affairs of the Federal Medical Center, which has key responsibilities of clinical services, training and research. And this is my 6th year as the Medical Director, and we've executed quite a number of projects within those years. So my expectation here is to learn more knowledge and skills to improve on what we've been doing.
Okay, thank you.
What about Professor Olaji?
Yeah, it's the National Hospital.
Oh, the National Hospital.
Yes.
Oh, okay.
He was his classmate in the university.
ABU?
Yes.
Great upside.
Great.
Good morning, facilitator. My name is Professor Hamid Ahmed. I am the Chief Medical Director of Ahmed Bello University Hospital.
Oh, ABU again?
Yes, the greatest. So, as you are aware, the ABU hospital is quite a huge hospital. So, I oversee the hospital in terms of research, training, and clinical services. So, I actually wish to improve on my PMT. I've done some PMT programs at Harvard actually.
Thank you.
I am Anas Ahmad Sabir. I'm a professor of medicine, internal medicine. I'm the chief medical director of Usman Danfodio University Teaching Hospital, Sokoto. The mandates of the hospitals have already been enumerated by my colleagues. I have over 3,000 staff that I manage with MIT Hospital. Thank you so much.
Thank you.
Yes.
I'm Dr. Pakam Bwada, the chief medical director of Jos University Teaching Hospital.
Jos?
Yes.
Wow. So I have...
Yeah, so my colleagues have already enumerated the roles of the CMDs in teaching hospital. They're all similar.
Yes.
My expectation here is to learn more on project management. I've never had any formal training on that, but this is an opportunity. I'm hoping to increase, my capacity and knowledge on that.
Thank you.
Thank you.
Well, my name is Mr. Buba Mohammed. I'm from the Nigerian Extractive Industry Transparency Initiative, NIT. I'm the technical assistant to the Executive Secretary CEO, and also double as the head of Control and Compliance Unit Audit. Our location is in Abuja.
Okay.
Yeah. My role and responsibilities are to ensure optimal implementation of policies in the organization, and also support the Executive Secretary in his day-to-day responsibilities. Yeah. Project management, I've been trained by TGS, so I'm a beneficiary of TGS training. So our expectation is to broaden and deepen our knowledge in project management. Thank you very much.
Thank you.
And under the supervision of my boss here, Mr. Usman, he is the Director Executive Secretary's Office. Even though I'm a technical assistant, politically I'm his head. Officially he's my boss.
Okay. Good morning, facilitator. Good morning, everybody. My name is Usman Abdrahim. I'm the Director Special Duties or Director Executive Secretary's Office. I work with the Nigeria Extractive Industries Transparency Initiative. This is a subset of the Extractive Industries Transparency Initiative, the global body based in Oslo. At least my colleague has already said all I need to say. So I think we're okay.
Okay.
Yeah.
Thank you, everyone. Good morning. My name is Bridget Ashan. I work with the Nigerian Social Insurance Trust Fund. I'm a regional manager, general manager in charge of the FCT region. And what we do, like my boss had said earlier, is we provide benefits and compensation to workers in case of any workplace injury and their dependents as well. And I must state here, we do this in the case of death up till the age of 21 for the last child, when the last child attains 21 years old or graduates from tertiary institution, and we do pay out this compensation and do a lot of other things including rehabilitation and all of that. And as it comes to formal project management training, I was certified Prince 2 years ago, change management, PMI, but the funny thing is that I did this towards ICT. I was at the ICT department then because I'm a computer science graduate. So everything I did then was focused ICT, but now I'm in the field operations wise, so I want to see how I can make this focus towards my goals and objectives per annum. Since project is supposed to be something temporary that has results at the end, so I'm hoping that at the end of this I'm able to tailor this to my yearly goals and objectives and targets.
All right.
Thank you.
Thank you. Is that? So that's just a little bit about myself. My educational journey is there, and I wear many hats. As a trainer, I'm a quality expert. My PhD was based on quality in construction. FHA, I'm owing you guys a lot. I'll tell you later. Because during my PhD, it was FHA I came. My research was in Nigeria, though I studied here. But the quality issues in the construction industry in Nigeria was my main focus. And I came to Nigeria 6 months collecting data. Even FHA, they really helped a lot. And even when I developed my model, I took it back again to FHA. Then Dr. Abalaka, maybe you may have heard his name, you know. So I'm a construction health and safety consultant. I worked with NSIT in Port Harcourt. Yeah, I am one of the lead consultants to the National Assembly on Health and Safety. So we're in Port Harcourt last December with some of your staff. Yeah, NSIT. Then I'm a speaker as well. So that's just a little bit about myself. And I've also been I've been at the global stage. I was one of the global speakers at World Quality Conference in USA in 2023 in Philadelphia. It's the largest gathering of quality professionals in the world. So, and that's me here also in Romania at another conference. Then meet our team. John was here yesterday. Yeah, he was here. That's him there. That's me, the founder of TGS Learning, Chris, and our administrator. Then this is a little bit about some of the trainings across the world. It's not just a few. In Aldi, Motivation, it's a pharmaceutical company, Fire in Australia, in Austria. Whether product or service, they go through processes. And if you don't have the right process, definitely it's going to be difficult to get the right results. And that's why there is this focus on processes. You have the input, process, and the output. So imagine the input is not right and the process is not right. Definitely you won't get the right result. So from the beginning, at the concept stage of any project, and I think that is where many people go wrong. A lot of times we jump into things. I've managed projects here in the UK and I've managed projects also in Nigeria. And you know it's quite easy to become a project manager here in the UK on site. All we do here is more of documentation. Because before they come to site, everything is well planned. You know when this is coming, you know who is doing this. Your own is just to ensure that. And even the workers, they are not trained. But sometimes where we come from, even someone that doesn't know how to do certain things, he will tell you, "Oh God, I can do it." And at the end of the day, you will not get the right results. Now, what then is project management? We've established a project already. It's a temporary endeavor. It creates value with expected results. Now, what then is project management? I'm just trying to start up with some concept first before we start going into some exercises. Look at project management. It's the application of knowledge. Let me tell you this. Every practice rests on theory. Every practice. There is always a theoretical background to certain things. A lot of times we may not know that there is a theoretical background to it. And that's why when we talk about competence, I've defined competence in several ways in some of my training. Let me put it here for you. When we talk about you are a competent project manager, what are those things that make you a competent person? Number one, can you still remember, Prof? SKATE, which is skills. What skills have you got in managing projects? Number two, knowledge. You need knowledge of what you are doing. Three, experience. Thank you, God bless you. I put attitude. 4, training and experience. 5, experience. So these are the models most times I use when we are talking about someone is competent at his job. We try to look at each of these. But for me, do you know the main thing? This can spoil everything. It can spoil everything. A lot of times when you have the right attitude, even the position that you're not even fit for, someone can bring you in. Because with the right attitude, you can learn the skills. Attitude is not something we can truly learn. We can improve. It's in you. It's in you. And that's why later on we'll get to the area of motivation. Recently I was in a bank in Nigeria, and There is this lady at the customer service. So when you see her, later on you will see the category. You know, when we talk about personality traits, there are some positions that you should not occupy because of your personality, because of who you are. So the HOP, something happened and he said I should go and meet her. And I said, no, I don't want to meet her. Then another person also was complaining. So people were complaining about her. Then I was talking with the HOP. I said, look, someone like this, she's not going to change. No matter the training you give to her, this is her personality. You know, some people in mood swing. She's okay now, the next minute, you've not done anything wrong. She's off. Some people are like that. This is who they are. You can't change anything about it. So the best thing that can motivate such people, take that person, not from the customer service. Such people are very good at their job. they are very good technically. So you withdraw that person and put that person in maybe at the background, maybe data analysis. So that you will not have that interface with people. So that's why attitude, I think, who is HR here? HR, okay? When you are trying to recruit, the recruitment process, I know most times we focus on experience. Even in this country, if you want to get any job here, they don't care about your certificate or whatsoever. All they are after is the experience. And when they come on my training most times, I try to let them know. I know, you know, people have different level of training. I'm not a core HR person, but I was employed one time to a role, and the feedback I got when I applied for the position of a medical, I worked as a medical device company. Ajo is the name, it's a global device company. I applied, they even called me, I didn't even apply. They saw my CV online and they called me. So when they called me, I didn't even know the name of the company. So I now researched about it. I said, hey, Ajo is it's a global medical device as the head of quality in the UK and Republic of Ireland. So when I went for the interview, I saw, you know, when you go for an interview, you saw white people. They come before you. In my head, I said, I will not get this job. You know? So after they had already interviewed about 3 people before me, I was the 4th person. 2 days later, they now called me, congratulations. So I now asked the director and also the HR, I said, why did you pick me over? And some of these people that came, they had medical background. Some of them are pharmacy, some of them are biological. They are from the medical field. But when they asked me, I said I've never been in the medical field. I've been a construction person and worked in different companies, but in medical, I've not. Do you know what he told me? My director, he said, the attitude you displayed, it was quite obvious to see during the interview, and you were honest with us that you were not having a medical device experience. But the other attitude, that was what made them over the rest. And you know, when I joined that company, within 6 months, there's this course I do, ISO 13485. It's a quality system for medical device. If I start on that course, you might think I've been in that role for over 20 years. Why am I emphasizing on this? Most times, the challenge that we have is not that we don't have the right skills, it's not that we don't have the right knowledge, it's not that we've not done much training or experience, but the attitude. And it is that attitude that you can use. That is the soft side of project management. Most times, because we've gone beyond technical areas already, based on our position. And as a project manager, you don't need to have the technical skills. You are simply a coordinator. As a project manager. That is a lot of things people don't know. When our Nigerian youth, they say there are no jobs, I say it's a lie, there are jobs. Because people don't know some of these things. So these are some of the things. Then look at this, application of knowledge, skills and techniques to project activities to meet project requirements. Later on we are going to see what are these requirements to meet also the specific goals. Most times, do we even at the beginning of a project, do we identify some of those specific goals? The problem we have majorly, even on personal projects, is about knowing what are the goals. Why are we doing this project? We call it business case development. Your why for the project. You know me? Very well. You remember? Thank you. Now, let's move on. It involves planning. Project involves planning. I think this is one of our greatest, challenges. It's planning. Planning for what? What are the risks on a project? Have you planned to have the right people on the project? Competent hands. You discover someone that is not competent and you are giving that person the project to handle. What do you expect? Definitely you can't get the right results. Then, organizing. That is still part of project management. You organize things. Then you manage resources. I think this is where most of us fall in. The CEOs and directors. How do you manage resources? Then to bring a project from the concept stage to completion and it is delivered on time. There are 3 legs on the 3 constraints of the project. You have a timeline to deliver it. There is a cost allocated to it and quality expectations. Quality. And another thing is this, based on our environment, quality sometimes is lacking in most of the projects. Quality. What then is quality? Do we really try to define some of those quality requirements before we venture into a project? These are some of the key things that are missing. Now let's move further. If you have any question, please feel free to ask this and contribute if you have any experience to this. Then quality standards. How many people are aware of ISO 9000? Have you done it?
I'm an implementer.
You are an implementer. So you can carry out an audit, right?
Yes, I can.
Against the standard.
Yes, the controls.
Against the requirement, the 10 requirements of the standard. Good. ISO 9001. That is another course I recommend. It's the quality, the international standard. I'm a lead auditor. ISO. Once any company or organization is certified to that standard, even in the eyes of the international community, like the hospital, CMDs, you can try as much as possible so that you can, though it takes time for you to get certified to that standard. It takes like a minimum 1 year and it's expensive for you to do it. But the benefits to have a formal quality management system, you can't quantify the benefits. And it will also help the efficiency and effectiveness of the organization. So standard, to which standard are we developing some of these projects? Is it the industry standard? Is it the national or international standard? So we need to specify some of those codes. Alright? So the second part of it is the feelings. How do you feel of that incident? Then you try to evaluate what went well, what did not go well. That's evaluation. Then the next thing is analysis. You analyze. From the situation, what can you learn from? Then you conclude and you take action. We call it Gibbs reflective cycle. We can use that also as to learn from experience. Then another key part, define roles and responsibilities. That's another major area in project management. There's what we call RACI model. Have you heard of?
Yeah.
You've heard of RACI model. We can use RACI metrics. It's like this. Who is responsible? Who is accountable? Who do you consult and who do you inform? Then you have the task here. Who is responsible for carrying out the operation for this patient? Who is accountable? Who is in? What's the difference between responsible and accountable? Anyone?
Carrying out a task.
The task is responsible. Then accountable?
The person who supervises.
Good, thank you. Then who do you consult?
You just inform. Somebody you just give
So we can use this as part of roles and responsibilities. A lot of times when we don't assign roles to someone, that job will not be done. Always in any project, assign someone. And you know people, we have people, we are all humans. By the time you call one person, please, I want you to be in charge of this, you've empowered that person. Outside his own role, a lot of times, even within your team, outside his major title, you can give another this thing to the person. It will really help us. Then manage by stages. We all know projects are broken down into stages. We call it project decomposition. Managed by stages. No matter how big a project is, learn to divide it into stages. Okay? That's one of the principles. Then managed by exception. That one is managed by exception is, for example, you have some, maybe you are doing a project and it's about 100 million. Now, in a situation where that 100 million will not be enough for it, there is an exception. It's just like contingency fund and management reserve, where you have upon you. You've exhausted this 100 million. Then you are now putting up your exception report for additional fund. So that is what we call managed by exception. Then focus on products. The product or the services that you want to deliver. Once your focus is on it, it will help you to now put the processes in place to deliver that product. This is Prince 2 principle that I've adopted. Then tailor to suit the project. Tailor. This one is key. All projects are different. No ever two projects are the same. No two projects are ever the same. That's why one of the characteristics of any project is project uniqueness. Even if it is the same cloth like this you see buy from the store, there are still some differences. And the uniqueness could be people doing it, different location and all that. Every project is different. So let's focus, tailor to suit the project. Any questions so far so that we can go on break? When we come back.
Managed by exception, yes. How does it relate to scope creep and requesting change?
No, that would, sorry, there's what we call project scope creep. You use exception to manage the scope. In any project, you need to define your scope from the beginning. This is one of the reasons why many projects fail. We call it creep, scope creep. Maybe you wanted to do one small project, it keeps expanding, it keeps, and you have on the day. So you use manage by exception to manage the scope of the project. Scope is critical. I will emphasize on that. Let's have 15 minutes short break, please. Then 15 minutes is 15 minutes. Once you've done the requirements, you go through the design, you finish at that stage, and you go to implementation. At the implementation stage, sometimes you discover that there are challenges within the design phase. Then you go back. So that back and forth at the end, it may slow down so, but there are some, it depends on the type of project. There are some definitely you need to follow this way. And one of the key things that will be able to help you with this type of methodology is what we call gate reviews. Is anyone familiar with gate reviews?
Yes.
What is it?
Well, the gate review, I know it is in terms of, like I told you, I have also part of documental review.
Yes.
There is the midterm review, whereby midterm way to the project implementation, all stakeholders are called upon to sit down and review all the challenges and whatever of the project and see how to mitigate it and move forward.
Okay, that may be project evaluation.
Well, we call it midterm review.
Midterm, yeah, it's different from gate review.
So if there is need to review the project, to review the scope, to review the budget, to review even the staffing and whatever, you do it at that midterm review. That is the window you have to.
Okay, good. Now, there are different ways of reviewing projects. And one of them is what we've talked about, project evaluation reviews. But what is called gate reviews is, look at this. Once you gather all your requirements, once you meet a client, he has told you, this is what I want, this is what I want. At the end of that gathering of the requirements, at the face of it, you will call it gate reviews. You pause and you review it for justification. Once that is done, you've passed again, you've gone to design stage. Once the design stage is done, you pause again. That's why we call it gate. It's a go, no go decision. You know, one of the principles of project management is continued business justification. We want to know if actually there is still justification, there is need for that project to continue. And if there is no need, it is better you terminate the project. That is what we call gate reviews. It will help us so that we will not carry it through all through the end. And at the end of the day, the benefits will not be realized. So this is the waterfall. Now, this is agile. This one, let me just explain to you so that all this you are seeing here will not be confused with it. Now, in software development, in the past, they were using this waterfall. You gather all the requirements, why do you need the software? Now, it takes time to process to get out the software, maybe about 2 years. By the time it comes out, it becomes obsolete. So all the software developers in the early 90s, they now gathered. And they said, what can we do so that we can do it in sprints, in iteration, in small phases, so that you will not wait till you gather the whole requirements before you start up a project. So that is the agile way of doing things. The whole essence of it is adaptability. But the only disadvantage, one of the disadvantages with it is quality may suffer. Because you will not get the whole requirements before you start. It's just like you want to develop a software website. It's more of agile. Because you may not have all what you need from the beginning. The little requirements, we call it backlog. That is just a terminology. You will call it backlog. You gather product owner, then you have the product backlog. Backlog then means requirements that you are gathering. It could be from the customer, it could be from the patient, it could be from the client. Then once you have that, there's what you call sprint planning. You have up to 4, 5, 6 requirements. You now move maybe 2 out of the 6 first into sprint. You plan it and you do it in small bits. We call it agile. So you will not wait, and in that case, you are also carrying the client along the entire process. So that if there are defects, it will quickly be identified along the line. That is agile. But these days, people tend to use what we call hybrid. They combine, the traditional method with the agile. So it all depends on the type of project. So now, okay.
So who's then the Scrum Master?
Sorry? The Scrum Master is the easiest knowledge to is like a project manager. They do it because the framework for agile is Scrum. So the Scrum here is like who is in charge of the team. These are the developers. They use it in software development. So the Scrum there is like the project manager. He coordinates the team that is solving the problem. So that is the Scrum Master. It's another, there's what you call a Scrum product training. And in this country now, they are looking for people in that a Scrum Master, seriously. It's just the equivalent of a project manager. You coordinate all your teams to develop some of those things. Who is in charge of that team? That's the Scrum Master. Thank you. And another good part is there's what we call sprint review. Once you've done that, you review it. Then after the delivery, there's what we call sprint retrospective. You look back to look at what did you do well, what are those areas, because there are always opportunities for improvement. In all that you do, no one is perfect. So always think of looking back at the project that you've done for improvement. Then Six Sigma framework. This is another way of managing projects. And let me say this, Lean Six Sigma. See, it is a course that you can never go wrong with it. I have master black belt.
Yeah. No, there is master
In short, it's one of the.
So how many stages?
Yellow. Some there is white belt, but white belt is just awareness. Then you have yellow belt. Then you have green, black, and master black master.
That is the peak.
That's the peak. You don't need up to that level. With green belt, you are good to go. Yes. So it's a systematic way of improving organizational processes. And the advantage with it is there is no way with one places there is no organization like that. Even World Bank, all these places are together. Some persons will just do it and they'll go to it. So that's why when people say no job, sometimes I keep wondering. It's about information and technology that you have. Myself, I've suffered here in the UK when I came initially. So sometimes, and because of my personal story, that is why I always go to Nigeria to gather the youth together and tell them, stop following politicians, add value to yourself. The same people you are following, looking after, they'll look for you. It's all about values. So why am I telling you all this story? In as much as, yes, God has helped you, you are in this position. Now ask yourself, if you live, some of you are still young, a chief medical director, after retirement, what next? So it is this, and you are not trained to be a business person. Even if you build hotels, build this thing, at that point, is when you retire, you know how to manage those things. You just give it 2 years, everything will scatter. But because of the values you have now, at that level, you can turn into consulting. And these are some of the courses that we are doing. Don't even wait for government to pay for some of these things. Once you have all these things, you don't need, I tell you, I'm not saying you don't need anybody, that's not what I'm saying, but the idea that you must know somebody before the, I don't believe in that. I'm a consultant for PSI, but it's as a result of the man saw the values, and it's very helpful because it's not everybody that will build a platform. So please try to, especially on this course, if not for you, for your children or for your brothers and sisters, lean 60.
So it's 1 week.
This 1 week for the green belt online. No, you can do it online, but it's better face to face because it comes with a lot of activities, a lot of exercises, and it's more statistics.
You can do it in Nigeria face to face?
Yeah, I do it. I'm coming to Nigeria 2nd October.
Okay. Okay, you are the resource person.
Yeah, I train it.
Okay.
Yeah, that's even.
And you want certificate?
Yeah, of course. I've trained a lot of people.
Once I finish, I join you.
You join me. I give people platform, even in this training. I go around the world right now. So these are the framework. You make that one. It's a systematic way of problem solving. You define the problem, you measure it, you analyze. That is, you look at the root cause of the problem. Then you improve. That is, you proffer solutions to it, and you control. The CEOs in the Toyota environment, they don't sit down in their office. Just like you said, you go round. That is what Gemba is. Don't rely on the reports that is coming from your team. So the Japanese, what they do is they go round. They go round, unannounced. And you are not going with fault-finding mission. The last training I had when I talked about Gemba, Professor Robinson from Abak.
No, Robinson is Ebony.
He called me some weeks ago. He said, do you know that the Gemba you taught us, I started implementing it. To the point that I even gave an example in the class one day. I said, look, for example, we have drivers. And the drivers, maybe sometimes they come to work late and sometimes we will be shouting at them. Have you taken time one day to even say why or where they live? So he now took time to visit the driver with his wife. It was at that point he said, no, he has to appreciate this. The distance is coming before coming to work at that point. So sometimes these are some of the tools that we need. Don't, good, you are a chief medical director. Don't even allow, maybe in the night, you go around, greeting everybody, hello, how are you? You are not going there to find fault. Not in a way they'll see everybody will start running around. Be friendly. That's what the Japanese were doing. So in the course of doing that, hello, how are you? Are you okay? You'll be able to see the system that are not working. It's like go and see. At that point, you know it becomes so easy to manage. Now look at environment. You look at the processes. You look at the location. You look at complexity. You look at the suppliers, regulators, the stakeholders. So in any project, please understand what we call context. Are we familiar with personal analysis? We all, you can use some that are not aware of it. It will help you. There is what we call internal and external factors. Political factors, economic factors, social, good, technological, legal, yes, and environment, and others. These are framework you can do external forces. Like some of the things we'll be discussing, some are external. And most external forces, sometimes you may not have control over. That's why we call compliance. You tend to comply to some of them. But it's good you understand first on any project. Then what are the internal factors? What are some internal factors? It could be competence. It could be the culture in the organization. It could be the tools that you have in managing some of these projects. Whatever, most times we don't invest in equipment. This country is more about equipment. Equipment. They don't do it at all. Go to some of our hospitals. One day I took my daughter, she was sick. And she went to hospital. So, and you know in the hospital, they'll give you menu to select. She likes food so much. She has already selected the evening meal. And they discharge her in the afternoon, she take cry. My wife wants to kill her. That what kind of daughter is this that is embarrassing? Because of the comfort of the environment. Here they will be the one chasing you. Every 6 months I get later, come and check your vital organs. They will keep sending you. Because they believe in the health of the people. You need to be healthy to carry out whatever you want to do. So sometimes it's about training. So our environment needs to be focused. Now again, Oga, I'll face you guys. Now, at times when you go to some of our hospitals, you will look at, I went to Lokoja one day, and I was observing. If you see the way nurses behave to patients, it's something else. I was observing her and the way she was acting aggressively. I don't talk down people in the public, but I was forced to. At that point, I said, wait a minute. What are the principles? I know the principles of nursing. The area of empathy, compassion. Who wants to be here? The same you can be sick tomorrow. When you train at all, you know when I started, fear now because you didn't know. I know it is common with our environment. Those things are common. That is why sometimes we still keep emphasizing on ways we can improve. And if God has placed you as the head, no matter what you say, if you are the leader in a place, change can be driven through you. You may not achieve the whole result that you want, but there may be improvement. So environment is critical. Industry norms, technology management, politics, yes. There's no way you will not play politics. Even within your family, there's politics. But how do you understand your environment? Then a simple organizational structure. Structure also plays a vital role. How do you structure the organization? It's very important. If you don't get it right, most times, whatever problem you are seeing in Nigeria, it's not as if it's not here. Yeah, I train, many civil servants here across board, but it's not that it's in a different level. The structure is very important. the people you are putting up in managing certain things. Now, we tend to use emotions. We tend to use, people that we know. We need to detach that when we are placing people in a position. Don't get emotional to certain things. Because it's from my place. Because I know yes, it's good to help people within your region. But then, why would you place someone that is not competent in a place over someone that is competent? So, organizational structure. You have a host, program or portfolio, project sponsor. Who is a project sponsor? Who is the project sponsor? Madam in the context of project management. Client. No, a client appoints a sponsor. The client will say, I have money to develop a website, and he gives the money to that person. So that person is acting on behalf of the client. No, the contractor is the one doing consultant. Yeah, consultant.
The financier.
The financier, yes, he is the financier, so the project sponsor. He has the money that's sponsoring the project, and he now appoints the project manager, a competent project manager. Then we have quality assurance team. We have team managers and administrative support like finance, all these other areas. Another thing again that I've discovered, if you go to many ministries, many agencies and organizations, they may not have a quality manager. Like, who is the quality manager? Quality manager is in charge of many things. No matter the industry. There is most companies you go here, you will see no matter how small, there is a quality person there.
Well, what they have, they normally have the maintenance department, but they have facility manager.
Yeah, it's different from quality.
Yes, I think it depends on the structure
of the organization. Yes.
So you will see there are certain organizations, even what do you call it, the management or general service,
yes,
whatever you call it. They have their structure and then how they
classify them. Okay. Because why I'm saying this is always good to create that quality department within the organization. Create that team. Because quality is in charge of everything. They are in charge of all other departments. Is it procurement? Is it finance? You are the heart of all other areas. Because what you want is everything is a process and one will affect the other. So the job of the quality manager is to go around.
Well, I think in the system of ministry we still have not quality assurance, verifying is it what do you call it?
Verification team.
Kind of stock verification. Because stock verifiers. Because whatever you supply to the organization, whatever you do, it has to go through that verifiers.
Okay.
To ensure that what you supply or what you do is the specification of what it is.
Yeah, it's okay.
But that is the context of
what about this monitoring? Yeah, it's still the function of the quality manager.
We have all these
I think sometimes in the context of Nigeria, the only place I see that they have quality control is places like NAFDAC, Standard Organization of Nigeria, because those places are key. They are managing
that has to do with products
and services.
Yeah, that's why what we are saying now, the essence of, sometimes is to know, even in services, quality is at the heart of it. Yes. And what I've discovered is quality is not that serious topic within our ministries and organizations. They may have their own way of managing quality.
But sir, the structure here in Nigeria are quite different. Like he said in the standard organization and NAFTA, like in my ministry, we still have a department, weights and measures. Okay. They are in charge of kind of that quality and value for your money. In terms of they go around each year or after some time for sampling.
Okay.
They go to
it's still part of quality.
So it's part of the quality.
Yes.
what I did, because if you look at the structure of the agency's ministry,
yes,
the departmental structure sometimes is a bit, you might not have this quality control. What I did in my own case was I set up a one-stop shop for all my projects. So that's where I could pick a quality control person in the outset who is competent, who can deliver.
Yes.
So that person gets directives from me.
Yes.
It's a board. It's a one-stop shop which we picked everybody from different departments.
Yes.
So and that person now works more like a quality control person. But the departments, the way departments are in Nigeria,
yes,
it won't give you that
name. Yes. No, the whole thing is whether the name, the whole idea is to have, like here, there's something what you call continuous improvement management. So in every country is different, but the whole idea is, please, let's create.
Well, I think there are different departments, they do certain
things.
Yeah.
Which is still part of quality.
Like in the ministries or other organizations, we have the PRS department who are in charge of all this quality control apart from the other departments that are doing. That is to ensure that projects are being implemented based on the requirement, based on that criteria. So they go on that, just like the budget office, you have budget department. They also go monitoring to ensure that what is given to you,
it's still part of money.
But I think what he's saying is that like a group or a set of people that is even controlling all these people you are talking about.
Yes.
So it is the structure that differs. What they have here, they have a department that is quality control. What we have there are some places where you have the quality control, but there are places that they share that responsibility amongst the departments.
Yeah, the whole idea is this, which however name it is given. All right, responsibility of the project manager. What in your view is the responsibility of the project manager? Anyone?
When we say coordination.
Your coordination, good. What again? Supervision. It's optimized value. Optimized value. What again? Communication.
Effective communication.
Effective. Yes. I love this class. One of the major
reasons. Mitigation, because you have to mitigate.
Thank you. What again? Risk, communication, change management, procurement process, quality improvement. A lot has to be done through a project manager. Sometimes you can address some issues and escalate out of, and you are accountable for the project delivery.
And then another important thing for project manager, you need to identify stakeholders, key ones, and then carry them
along the entire line. Good, that's right. So these are all, they are all there in your, they direct you, motivate the project team. What is your definition of motivation?
That is the board system.
This is a very serious one.
Why? What is?
Because in some, I will talk in my own place.
Yes.
The reason why we are becoming moving is, before I start any project, I will make sure, to be honest with you, if you don't, you know, housing is a very serious thing in Nigeria. And the only way I'm able to survive is if I'm doing 200,000 units.
Yes.
I will say direct cost, GM come, take one. If you don't do it,
that's motivation.
That's what I'm saying. But some people can also say it's corruption. But the whole truth is a reward system. So once they get that, everybody will keep working because their main aim will be the end product. Exactly.
Thank you. So these are ways to motivate your team. Now, another key point of motivation is I did an extensive study on motivation. What may be your own definition of motivation may not motivate an individual. What you think is motivating someone may not. Is money a motivation?
To some people.
To some people. Most people. Yeah, of course, money motivates to some extent, but not in the long term. Money does not motivate.
Even the training is part of training. Training is part of
it's part of. So the whole idea is, if you are a project manager or you are a leader, look at those things that are motivating. And you know, from the research I conducted, number one thing that can motivate an individual is to identify the skills in that person and place that person there. Alright. If you know this person is good in this area and you position that person in that area automatically. Yes. So that's number one. Number two is carrying people along. From my own research that I conducted, carrying them along in the process. And the third one is personal growth. If I know that this thing I'm doing, there is that personal. So there's what we call the project success criteria. Most times before you start, what are the success criteria? What is that level that if this is done, I will be able to accept it? Acceptance criteria. It normally comes from the client or the customer. You support the project manager as well. Then you monitor project progress. Most times you don't do monitor. And without that, it will be difficult based on our environment. Now, project life cycle. There are different phases of a project. There's what we call project initiation stage. That is at the beginning, conception. You have ideas. I want to improve the organizational processes. It's a project. How do you do it? How do you improve it? That's, you define the project. Then you assess the feasibility and secure initial approval. That is at the initiation, that place of concept. That is the first stage. And it's not, you don't do it just once. You engage stakeholders to know exactly why are we doing this project. That is the phase also you develop the business case to identify what are the risks, what is the resources that we have in order to execute, to start up this project. What is the point starting something? Recently, in my family, there is this my father's house, and they say everybody should come within the family to build the house. And the people that are talking of building this house, if you ask them to bring 10,000 naira, they don't have it. Common inheritance. And the project will cost over 80 million. And they put a design. And initially they even excluded me from the committee, the building committee. They put up a structure, 3-story build. Now in the group, WhatsApp group, I asked the question. I said, please, I want to know the source of the fund for this project. That was the question I asked you.
Then you started.
They say by faith.
By faith?
I said, they said faith that we should, we have great people in this family, why should other people, they build story building? I said, wait, now if it is by faith, let one person use that faith to build his personal. Some of them say there are no personal project. Go and use. I said, I want to know what is this, so where is the money coming from? Everybody. I became an family group. Yes. That was just the question I asked. They say me that I'm an enemy. I don't want the whole. I was shocked to my own man. The level just Then you go to a place of planning. You develop a detailed roadmap. What is your goal? What is the scope? Those resources. These are planning. You need to plan for them. Plan for the people handling the projects. Plan for resources. Plan for expected risk. Then execution. That is the stage of implementation. I am not saying that even if you plan everything, you will get it right. And even in part of the plan, there's what you call contingency plans. You can carry, if this happens, what am I going to do? And you need to have a risk management process that will be able to handle some of those things. Then you monitor, you control. That's why monitoring and control. Without monitoring, how do you control? And you have to put it different way. These days you can use technology, if possible, to monitor certain things. Then you need to have even your report. What is your level of report writing? Is it on weekly basis that they give you the report? You need to put without a proper monitoring process in place. You cannot deliver any meaningful project. So you track progress, manage changes. Once you've done the execution, you remember I was talking about snagging process. It's still part of monitoring and controlling. Because you want to control for defects. What you don't want is to have that negative image to the public, your delivery. And that is why it's good to have those internal verification process. So what I want us to do now, we are going into group. I want us to use this, either the projects you've done in the past or the current one that you're doing. Do a background. Just all these things has to be done maybe, let's say 20 minutes. And I'll give you the time each group to present your case. One person will present for the group. And the group that wins will clap for the group. So come up with any, at least you have some current projects that you are doing. Look at it, describe it. Forget about the options appraisal. Look at this, check the expected benefits. Then on the cost aspect, you may not have all that information at the moment, but you may just form some cost aspect of it. And I want you to look at the major risk in that project and what is the timeline. This is how to develop a business case. So I don't know how.
Yeah. I started with 2 courses, but now I have about 6 courses. Okay. And the number of students we started with about 100 students. Now I have over 1,000.
Oh wow.
Depending on how
we didn't have how long?
Now we have over 1,000 from 2020 to date.
We can even use wood.
Yeah. Like the American style.
Wood construction. Block construction, precast.
Why we choose this is because of what?
Expected benefits are already slightly here. Enabling physical participation, networking, shared experience, we have already done.
The expected benefits.
Okay.
The commercial aspect.
The cost investment appraisal and funding arrangement.
Yeah, so cost investment appraisal.
And the arrangement, the funding arrangement, federal government and the collaboration.
What of the investment appraisal? Let's talk about the under investment appraisal.
Okay.
What is investment appraisal? What does that mean?
Just keep it, put the funding arrangement.
Most of the time, what we do in molecular lab is not even, most of the diseases we test are free. Like Lassa fever, monkeypox, 2.5 billion. So they have to be sponsored by government.
Which one are you?
I'm talking about most of the tests you do in your molecular lab.
Based on that,
free.
which one are we actually?
Getting the spray.
We have done very well.
Facilities. So, and then with it, I built house.
Yes.
Yeah, but that's
so it's from it's
okay. So how do we arrange this? What of the problem we have is also part of the
outcome of the profit.
Yes, it's from its asset.
Can we value the house? You know the value.
Yes.
Okay, our business case, we are looking at construction establishment of a molecular diagnosis lab. The strategic case, with the current pandemic of viral diseases and the communicable diseases like Lassa fever, Ebola, monkeypox, HPV, there is need for timely diagnosis. So optional appraisals, we also look at an issue like cancer centers because of the current generation of cancer. But however, why we choose the molecular diagnostic lab is because of the threats of communicable diseases. These are diseases that can contact immediately if they don't take prevention and if they are not controlled. And they need for early diagnosis and treatment plan. What are the expected benefits? Prompt and accurate.
Can we listen to him, please?
Our time is going on.
Yes, sorry.
So what are the expected benefits? We are looking at prompt and accurate diagnosis, prompt response, and mitigation to the spread of the disease. What are the commercial aspects? The cost, we look at the cost, we have about 75 federal centers in Nigeria. We look at the 1.5 billion per center, which is giving about 102.5 billion naira. However, the services are free, and the final analysis, the federal government, we look at the federal government sponsorship, partners, and NGOs. What are the major risks? Non-release of funds from federal government, as we have noted, fluctuation in prices of equipment, issue of power when you come to the Nigeria, the sustainability from because some of these things are free, and also policy change from partners and government. Time scale, construction will take about 6 months with the furnishing. Then the equipment supply, training and installation will take about 2 months, and services commences immediately on completion of the project. Thank you.
Okay.
So if fund didn't come from government or these sources you've mentioned, is there no any other way through which funds can be generated?
Sponsorship for individuals, NGOs, from government and from partners. It's a very big project that is difficult for one person to achieve.
Very good. Thank you.
This is the second group, and our project title is London Executive Study Tour. Yes, London Executive Study Tour is our project title. Yes. It's a business. As a consultancy, yeah. It's a business.
1 minute gone.
Yeah, and one of the strategic case, the background is that the benefit is to expose, broaden, and deepen executive management staff understanding of different concepts of leadership, my class will check. Project management, and opportunities to networking. And opportunities to networking. Can you use this? Okay, let me check.
3 minutes gone.
Okay, go on. Optional appraisal.
3 minutes gone.
We have looked at various options: virtual training, study tour, and conferences. And we opted to take study tour as our option. We look at the expected benefits. The benefits are to enable physical participation, to improve networking, shared experience on our different perspective of leadership, on the spot assessment of other practices, and best practices in other clients, then global best practices for improved service delivery. That is one. That is the benefit. The commercial aspect of it, we look at the investment appraisal, and we came up with there are 3 types of investment appraisal. We say the payback period, the net present value, and the IRR, that is the internal rate of return. And in this particular aspect, we choose the payback period simply because we look at how long our employees are going to stay in service, so that the organization will be able to benefit from what they have learned and the study tour visits. So we look at 3 years as a payback period. And we came with a cost of about 10 million naira per participant, including your airfare, cost fee, and your upkeep. So total number of our 50 participants, which is going to raise to about 500 million. MDS, the funding should come from MDS International Training budget for the year 2025. Most of the participants are public servants, and so therefore they should be able to charge their 2025 international training budget line.
You have budgeted inflation rate, you have budgeted 10 million.
Yeah.
So what will be the value of Naira at that time with the 10 million? No, yes,
we have already factored as a the cost fee for the training is about 4 million Naira, then your airfare and every other thing. So plus or minus, we are not routing it in dollars. We are using local currency. That is why we gave you in Naira. If you are looking at the exchange rate, we would have given you the value in USD, but we are giving you the value in local Naira.
200,000 units, bungalow in nature, for IDPs in Maduguri. And, what's our optional appraisals? Our optional appraisals in getting this thing done, we decided to look at 4: block construction, precast, wood construction, and burnt bricks, which is clay. So we decided to pick on clay. The reason why we decided to pick on clay is the weather. We all know Maduguri is a hot place when it becomes hot. And secondly, because of the paints. With burnt bricks, you don't need to paint. It stands there forever. What are our expected benefits from this? Actually, is on humanitarian grounds. So we don't expect to have any benefits because we want to quickly deliver in a situation where people have been displaced and they have to quickly move in. What's the commercial aspect? The cost of investment, appraisals and funding arrangement. In this, we're looking at an investment definitely close to about 3 billion naira. We are looking at funding from the federal government, the state government, because it's a war situation, NGOs and private individuals. And what are the risks and their impact on the business? Being an unsecured area that have just left average war situation, sorry, don't let me use the word, like, what do we call it back home? Internet displaced people. We still foresee the fact that there's still some skeletal kind of operations like bandits and all these people coming back while we're in operation. And we also look at some factor in the case of funding, because in partnership funding, in a multi-partnership funding, there's always this problem of one party not meeting those goal, the expectations they were. Then time scale, in a summary, we're looking at 1 year delivery because of the urgency, or in case maybe 1 year, between 1 year and 2 years. I think that's all.
Any questions for them?
It was as a result of high demand in nursing education. We are liking the case establishment of nursing school.
Okay.
Yes. So that was the idea came when we learned that many students cannot get admission in government school. So there is need to establish private school of nursing. So option appraisal, we now got approval from Nursing and Midwifery Council of Nigeria. The school was approved and it commenced. Expected benefit, it reduced the rate of unadmitted students. Most of the government school cannot admit high number of students in government school. So by the establishment of private school, many students will have access to nursing education. Then secondly, out of school students, as at then, you have to, if you are applying for any school, you have to go through JAM. As at then, you can just apply and we can give you admission. This is another benefit. And then we're able to graduate number of nurses, which before it was very low. Then employment opportunities. We have almost about 50 to 60 personnel working in exactly. So then the commercial aspect, as at the time when we started, we need about 300 million, but because we don't have that amount, we decided to go into a joint venture with one of the schools. I invested about 50 million, or we invested about 50 million naira, and then in a rented place. Now we have our own school. Through the revenue generated from the student, we're able to establish our own school. We built our own school
from the resources generated from that school, then the risk, that the major risk is if you are not able to get approval from Nursing and Midwifery Council of Nigeria. That's one major risk, because you can buy all the facilities, everything, and at the end of the day, the government can say no approval. That's the major risk. Time scale, summary of the, we started from 2020. By 2023, or by 2025, we graduated about 300 students in nursing and midwifery. This is just in short.
FB, which group do you think are presented in terms of following this, keeping to time?
We are done.
And also the project.
To be honest, I would have said all of us did the same, because no group was left out without being asked a question.
Yes.
So for the fact that every group has been asked a question, they don't belong to the same, level.
Don't balance no winner, no winner. So tomorrow, when I won't take long because tomorrow is like half day for us. So it's going to be 1 hour session for presentation skills. And if from my own, that's why I want to ask first, based on what is stated here, timing, composure, and all that. To be honest, this group all well. What do you expect? No, it's not because of that. The truth is this: you should have, this group would have won.
He left his glass.
But no, not because of that. No, he would have won because he's the only one that talks more on that commercial aspect by mentioning NPV, internal rate of return, and I'm sure it's from his experience. But he didn't do like someone prepared for it.
Actually, I wasn't supposed to present. Bridget was supposed to present.
So that was what really, if not, this group would have, because of that aspect. So sometimes they say little foxes spoil the vine. There could be one thing that will spoil everything. I'm not all of us. Your project is a very good one. The only area you said no benefit. So based on this presentation, for now, this is just a motivation. It is not the gift that counts, but the donation. So
justice for women.
So this is for you.
Use it, give it to the women.
Don't worry, women will special.
Make sure you can see me. Make sure you can see me. Send the page.
Then there is the esteem, respect for what you do. You know, when you get to that level, some people may think it's pride. It's not pride. You will not even know. Do you see celebrities? The way they move, it's not them doing it. Look at some people that are into singing. You may be talking with them. It's not them. The moment they climb the pulpit, they are different entirely. So we try to look until you get to that top level of fulfilling. That is where self-actualization. That's according to Abraham Maslow. So when you are handling people, managing projects, you try to look at the level of needs of individuals. Some, what they need is that love and belonging. The love means love within the workplace. Acceptance. Do you know you may be dissatisfied if you are working in a place and it's like you are enemy to everyone? So that is what Abraham Maslow is. Then there is Hesberg's this thing. Okay, on project hierarchy, look at Abraham Maslow. On the project, we try to bring it into different levels. Facilities, welfare, infrastructure, they are the lowest level there. Then processes and procedures. Most times this is what is lacking. Do we have SOPs in most of our organizations? Standard operating procedures. And if we have, do we follow them? It's not just having them in place. Do we actually follow our SOPs? Then we try to look at teamwork. Without teamwork, it will be difficult. Then recognition, then you have the project success. Now let's move to another one. This one is very important. it's not that familiar. How many of you have heard about Hesberg's? Good. Now, let me explain this to you so that you can understand. There are what we call motivating factors. And there are what we also demotivating factors. There are certain things that on its own, they may not motivate you. But in the absence, it demotivates you. Let me repeat. There are certain things that if it happens, you may not be motivated. And if it doesn't, you'll be demotivated. There is this my sister, each time going to Nigeria, I always buy things for her. Bags and different things. And each time I buy this thing, I couldn't really see that appreciation. So at a point, one time I was going to Nigeria and it wasn't convenient. I said, okay, even all this one I've been doing, I can't really see that. So there's no point stressing myself. And I went to Nigeria, I didn't go with anything.
You're welcome.
Man, the reaction shocked me. She started telling people, oh, follow Jagba. You know, she just used language, Jagba. I just come like that without anything. So, this is part of, meanwhile, I couldn't see that, this thing when I was buying. But in the absence, she's angry. She's demotivated. So, let's look at some of those things that can motivate us. And look at some of the things also that can demotivate. Do you know that even salary is not in the class of motivation? Yes. But in the absence, it demotivates.
Even if you delay.
Or delay also. But on the day you get it, you know you are getting it. Yeah. You may not. So according to him, there are what we call, why they are saying hygiene factor is mental hygiene. It's not this physical hygiene. Some policies are part of the hygiene factors. Administration, and once the admin is not a good one, wrong policy, lack working conditions, those things can demotivate us. Then look at some of the things that can motivate, according to his own theory: achievement, recognition, responsibility, advancement, and work content. All those ones are all motivating factors. So we try to look at those things that can motivate us. Okay, are we clear with this theory? Yes. Then, Tuckman development model. Have we heard of forming, storming, numbing, performing? Yes. Has anyone? Forming, storming, numbing, performing. It's about team development. You need also to have this knowledge about when you are forming a team. And team forming, there are stages. Now the first stage is called forming stage. That's you put up a team together, you are so excited that, oh, I'm going into this project. You know, that's the forming stage. And at that stage, the directors or the leaders will tell them what to do. The next stage is storming. At that point, ego will set in. You know this thing, you know we use it for in relationships. Yeah. The first time you meet a lady or meet a man, you are so excited. Oh my God, see the guy, see this. After a while, you say almost.
What is the reason for that?
That is why. That's why this thing
girls are complaining now that men will start and then.
Yes.
It's not going to then.
Yeah, it all depends. What about the behavior? Attitude. Sometimes. Yeah, it's a two-way thing. And it's see, in all, even in marriages, let's be honest. Let's be honest with ourselves. Most of us, we all go through these stages. Because at that point, I'm beginning to know you. Maybe the things, there are certain things that maybe I know you now, the one you are so happy, oh, fine babe, this, you know you are so excited. After a while, maybe because of getting close to you, there are certain things that you start discovering and it's not in line with your own values. Before you know, you start withdrawing. And another thing is this. Please, ladies in the house, close your eyes, forgive me. My elder brother used to tell me, He said, if you don't want women to hate you, don't tell them the truth. That's the truth.
We tell them the truth.
Not in all cases.
Yes. No, yeah, they're not in all, though there's always exceptions. Yeah. They may not. I have this, my friend, that time. He may be you. This guy, Jesus Christ, he can lie. Yes. There was a time, let me, I'm telling you this so I will go forward. We were on campus those days. And you know, after the school ended, personally, we were not having money to go home. No money. So we were on campus. So, and in the evening, we saw two ladies. My friend, he said, make me, I come, make me, to go and toast them. So, we went after them and we were gisting. Meanwhile, there is this man, Okon is his name. The name
at
90. Thank you. Okon, good. So, Okon, my friend knows this Okon very well. If he carries any babe come, he will do him, so he can give him anything. So he was eating on credit. We came, you know, then meat pie and
I was part of the credit.
Oh, thank you.
I'm in house.
God bless you. Thank you.
It's late now.
Oh my God. Thank you. Good. So, my friend, let me not mention his name. He was bringing out things to these ladies. And he now asked them, what are you guys doing on campus? And the lady said, oh, they are stranded. My friend, her sister's husband was working in NNPC. So he now lied that, oh, you guys, okay, I'll call Donia, I'll talk. He now took that man as his father. That his father is the director of services in NNPC. That the one going to Lagos, their driver will bring the ticket to her to go to Lagos tomorrow. Then the one me I was with, I was telling her that I'm stranded on campus. So when I was trying to tell her that, my friend now moved. My friend moved this girl away from my area of conversation and started talking. Do you know that that lady followed him to the room and spent overnight? Me, my own did follow me to the room. He's working for him.
There are some lies also when you lie to survive and actualize that lie.
Yes. Because he will tell you that, okay, that's the way, the strategy to get to you. Because you too, I do like and I cannot afford to do.
Even foreign presidents, they lie. Well, even Nigerian presidents all over when they lie. But when you get to that power, before you get there, you will now use that opportunity. So if you are trusting the babe and you have to lie, you would have seen something.
I have a friend, I was in her house one day, and she's a project manager, and she was having training. She's this very pragmatic person. If she says something she wants it done the next minute. That's the type of person. She's like that. So she was having meeting with top people. I was listening. So when after the meeting she started complaining, look at these people, I told them to do this, they have not done that. After she finished, I said, can I be honest with you? You are the problem. She said, why? I started explaining to her. I said, people are all different. Look, I take an example of myself. If I'm to study, I'm this type that I don't want anybody around me when I'm studying. I study at night. Meanwhile, another person can stay even in the marketplace and study. So that is what works for you may not work for another person. So trying to understand the makeup. Some are very analytical. As you are talking to them, they are analyzing which one is true, which one is false. They are looking through even what you've written, comma, full stop. Some are like that. That is, you are not going to change them. So why are we talking about this personality trait? So that it can help you as a leader, as a manager, so that you know where to place them. The training that you do, if you are an extroverted person, it becomes so easy for you. I'm not saying if you are not the extroverted type, you cannot become a great trainer. It's not. Do you know what will happen? Even in this psychology, there is what we call masking. What you do is to mask, is to try to become the extroverted person during training. You will struggle because it's not coming to you naturally. So know your makeup, then you now know.
But sir, in fact, I know all of us there are like government executives.
Yes.
But in personal funding,
yes.
Will you be able to allow this to play when you know the fund is coming from your personal pocket?
When you know
the funds for the business,
yes,
is coming from your personal pocket.
Yes.
Will you be able to accept all these traits?
No, you will not. You will not. That is why when you know that someone, like the example I gave earlier of customer service, you own a business now and you are setting up a customer service, and will you go and pick someone in that category of neuroticism? No, definitely not. But that doesn't mean that person is not good. You might put that person in another place. Sure. Even as a government parastatal, you are the MD of FHA now. You know, outside their major roles, you can form a team to develop, to do certain projects. That one, you just constitute this team. Then you now know, based on their personality, you know who you can make the leader of a team. Do you know most engineers are not good leaders? Leadership is different. See, I'm a site engineer by profession, right? Do you know engineers are results-oriented people? And also, even doctors, let me tell you this. When you make them as consultants, they are not that good in leadership. And I'm telling you from the experience I have because I've trained many doctors, consultants. And do you know why it is like that? They were trained to operate. They were trained to treat people and go. That is their core training. So by the time you now move them into leadership position, and at leadership position, what we are looking at is people skills, not too much of technical skills at that point. That is where the problem comes in. And because they were not trained in that manner. So you'll now carry that attitude of operation. You know, at the time you are operating someone, you are more of autocratic, you take decisions.
And so it was straightforward.
No time to consult. Some you take, so they will now grow with that attitude. So the moment you go into that leadership, that's where you now have to unlearn a lot of things. Let me draw this triangle so that it can help us. There's what we call conceptual skills. Then technical skills. Then people skills. People skills. Now, at this point, you need less of this. But when you are growing, concept technical, you are very good. And most leaders, do you know why they close their eyes to people in the technical school to behave the way they behave? Results. They deliver results. So they'll close their eyes. They may be complaining about a particular engineer. This guy is like this guy is like, they won't see anything. Then emotional intelligence. This one is here. Self-awareness, you need to be aware of yourself. So that if they call you to do certain things, just know yourself and withdraw from them. Self-regulation, how do you regulate yourself? How do you manage yourself? Then motivation, what are those things that motivate you? Then empathy, social skills. This is part of emotionality. It's a big topic on its own, but we can't go into all that. Odiba. This is why I said I'm going FHA a lot. Because this is from my PhD, I developed this model. Yes. And this is just to encourage you. When I was doing my PhD then, I said I was going to develop a model and name it after myself. And my supervisors were worried. They said I'm creating problem for myself. Because when the external examiners, when they come, they will feel like, who are you? Who gives you this audacity to name something after himself? What level of this thing have you got? You understand? And what made me to go into this is, in the course of the research, there were many times, some things that I've not seen in any book on my own. You know, PhDs, it's like you are a mad person. Then I was talking to myself on the road. All I do 24 hours, you keep thinking. That's why they call it Doctor of Philosophy. It's more of thinking. So most times I'll think, I'll come up with one idea. I'll run to my supervisor. I've not seen it anywhere. After a while, I would see that, oh, one of the quality gurus in the world has done it. So I now came up. After the data I collected, I analyzed it. I said there is no single model in construction that is attached to construction equality. And that was what made me to come up with this model at the end. It was FHA that even validated this year. It was FHA. Because after I developed, I went back again to Nigeria and they did the validation for me. You know, so I've published it. A lot of companies have used it around the world. This is, I won't go into all that, but you can use this model to improve the quality. In as much as it's in construction, it's applicable. Then the final, this thing for today, project management tools. What are the tools and techniques that you can use? Network diagram, Gantt chart, risk register, checklist. At least we should be using checklists. Don't be too familiar. No matter how good you are, just have checklists. Because you may make one mistake and it will cost you. Then work breakdown structure. No matter how big a project is, break them down into manageable stages. Then project planning software. Is anyone familiar with Primavera? Primavera, yeah. It's a project planning tool. If you learn it, in a day you can get £1,000 here in the UK. Primavera, yeah, project planning. It's a software. It doesn't matter where you live. Just be a project planner. That's it. Then Kanban. So, this is the network diagram. Is anyone familiar with critical path of a project? Yeah. What is a critical path? The short to finish a project. These are some of the language. So when you have a project, where is that? It will help you to identify the duration of a project. And that critical part is that part that if anything happens to it, there will be the delay in the project. There are some places you have floats. When you are having project, there are things you can be doing. You have allowance. But there are some parts that if you don't do this within this time frame, it's going to extend. So we call it critical path of a project.
Is funding part of it? And funding is part of it. Critical
funding?
Yes.
No, it's more about, no, funding may delay. Yeah, it may be delay the process. But funding is not.
But what about, let's say, you know, a decking has to stay 21
days.
So is that part of it if you don't do it at that time?
Yeah. No. Yeah, it's part of the critical part. You know, these days, even that 21 days is not applying anymore. The moment you still have to support, people will still, but if you use that as an example, that will be the critical part. That means within that 21 days, nothing can happen. So when you are calculating now how the project ends, you now say that one 21 days. From there again, other part. You use critical part to determine the duration of the project. Yeah, it can disturb. And that's why when you are putting planning, you plan for some of those contingencies. You know, so that you still have float, you still have, you know, time to play with your case. You know, a lot of things happen on the project and you may not. But the key point is communicate over time. There is a Gantt chart. You can use even that Primavera or Microsoft to do some of this. It will now help you to know, plan your project. Even if you don't do it in an official way like this, take your pen and paper so that you even have an idea of realistically when can you finish this thing. So that you will not just enter. Sometimes I weep. A lot of times I say state governors, they need to come for this type of training so that they even understand the key concepts of project management. It looks like it's simple, like all we have been saying today. It's not as if it's a new topic. No, it's possible. Do you know I have the mind that I'll go and meet one governor and I'll use that person as... No, it's possible. Some of them are good. The last time, my own governor from my state, it's not as if I have that close distance. That matter, is it not? When I saw all the list from PSIN, the last one we did in April, we did it here. I saw the list. I didn't see.
Which state?
Kogi.
Oh, that one can even come here and sit down and learn.
Yes.
So you can learn.
He would have been here. He would have come.
Yeah,
he was to come.
Ododo will come here.
He will come here. I told him he was to come. Unfortunately, he changed.
He lost his father.
Yes, he changed his flight.
Ododo will come.
I told him what he would have done is he said, I should not worry, he will walk into this place. He would have been here. No, not the white man.
No, Ododo.
He's a very simple, I don't even know him as much. Yeah, I will hear.
If not for that, if he promised you, he will be here.
He will hear.
In this class from
So I wrote, I told the administrator PSI that, sir, I'm seeing people from different states. Kogi, there's nobody inside. Can you make this thing? And I sent it to him. He was in Saudi Arabia. He called me. And he said I should tell him the benefit of this thing. Do you know he sent 4 people? It was even late. The head of service, accountant general, revenue, about 4 people he paid and they were here. So I started looking at, okay, since this guy is this simple like this, can I go through him so that maybe he can motivate others? It's about just having the knowledge. Look, all these things we are saying now, there are certain things you may know. It may not be because of today. All of us here, you don't know where God will place you tomorrow. And at that level, you now say, oh, I learned this thing, you'll be able to make it.
You just use the governor's forum.
Okay.
You write to the governor's forum.
We are in collaboration with them already.
Yeah. PSI can even do it as a this thing that want to train the governors on set. Oh, those ones don't keep them, just 3 hours. And breaking down projects into different areas. That's project breakdown structure. You break them down. Then Kanban. Is anyone Kanban board? Have you heard of Kanban? It's used in Japanese. Yeah, it's used in Japanese production environment. It's a board. Imagine now you are coming to site and you see what to do, what is in progress, what is done. It's a management style. We call it visual management. Kanban. And we're all familiar with risk metrics, risk assessments. Okay. And okay, and in conclusion and in summary, become the driver of delivering quality projects in Nigeria and do all you can to make quality a habit. Any question, please?